Physiotherapy or dentist, BPT or BDS in 2025, which is a better career option in terms of future scope, salary, and respect. If you have all these questions in your mind, this video is for you. In the first half of the video, Dr. Chandraprabha Kumar and Dr. Radesh Rao, who have established three well-known dental clinics in Mumbai, will be talking in detail about dentistry. In the second half of the video, I will be talking about physiotherapy, and in the last, as a friend, as a bade bhaiya, I will give my honest opinion that which career option is better. So, let's begin.
Uh, Myself, Dr. Chandraprabha Kumar, and he, Dr. Radesh Rao. We both are actually batchmates from our college, and we passed out somewhere in 2000. So it's been like almost 24 years of dental practice. But yeah, Knee Wellbeing's The Dental Clinic started in 2014. It was both our thought process that we should have some kind of dental clinic which is affordable and also approachable and very clean and sterilized part of it for all the segments of our people.
So yes, we got together to start these clinics. She said most of it, so that's how we got together and started this.
Okay, let's start with the first hot question. So, which is better according to you, BDS or physiotherapy, and what is the future scope according to you? Which will be better from both the courses?
For freshers, newcomers, I think BDS is going to be a little bit tough. Physiotherapy, I seriously don't know much about how the market is right now, but for BDS, fresh dental graduates, I think it is going to be tough because especially in cities, there are lots of dentists already there, and too many dentists already struggling in a sense, So it's really tough for fresh graduates.
Struggling in what sense?
To establish themselves, because
Okay.
in this field you need to, after you finish your college, to set up your practice. There is a big step involved, and then there's a learning curve. So there's almost a period of 4 to 5 years where you have to actually set up your practice, So that waiting period is also a big task, because once you're out of college, you have expectations, right? When you come out of college, you think that I'll do this, I'll do that, and when you come out and you see how the situation is, then it's like that's the different story once you're out of college. So that waiting period is there, and especially in dentistry, it is high compared to other field of medicine, I think, and there are not many jobs available as such. So you have to struggle for that period of time. Initially, yes, that is there. So physiotherapy, I'm not really very aware how strong this struggle is, but I guess thoda to hoga, but probably lesser than dentistry.
To add into this, I would say somebody who is really passionate about dentistry, I think they should go for dentistry, I would say, because frankly speaking, there are a lot of dental colleges which has come up, so which is giving out so many dentists coming in, and metros as it is saturated. So if you are really passionate about dentistry and the dental skills, then you need to have some patience also at the same time, and then accordingly go further. You have a good scope if you learn the skills. There are different subjects in dentistry, like the upcoming aesthetic dentistry, the implants, and everything else. A lot of airway dentistry, laser dentistry. So if you put yourself into that and study further and upgrade your skills, I think there is a scope for dentistry also. But yes, you need to have some passion for the same. Physiotherapy, I think it's really upcoming. I would say right now, when I studied, there was not much of awareness about physiotherapy. Now I think there's a lot of awareness, and I think it has been integrated in sports as well as in all the hospitals for every kind of problems. I think finally it comes to the physiotherapy. So there is a good scope compared to BDS.
What is the scope of BDS for a fresher, and when you have achieved, you have your own clinic, you have set up things, and after that what is the scope, and again in India what is the scope, and abroad what is the scope?
For a fresher, when the person comes out immediately, he can join as an associate dentist under someone. There is a learning curve there. Obviously, it may not be a good pay as such. Because you have to learn the skills properly, then only the main doctor will have the trust factor in giving you more money, because that is where it comes up. So not many people think, because we are always comparing us BDS to the other professions where they are earning a lot in the first go itself. Here we have to wait for that. So I would say, if you are ready to do that, learn from a good dentist, a senior dentist. Even though the pay is less, at least learn the skills. That 1-2 years you have to give yourself to the skills, and then you will improve with your salary also. I think the basic salary, I think it will start from 10,000 onwards, I guess, and then it will increase to 25 to 30,000. There are a lot of corporate chains which has come up, like Glow Dental, Sabka Dentist and all. They are giving a better pay, but again they are also looking for senior doctors. So freshers, still it will take some time. I think 1-2 years will go with the learning part of it.
Absolutely. As I said ago, once you are out of college, the scenario is completely different. So what you learn in college is not enough. So once you are out, you have to come and learn, either by attending more courses. There's so many courses available also after finishing your college, so you can do that also. And if you can, there's an option of studying further also. So BDS is just the starting point for a lot of people. So you can do MDS, or there are so many other certificate courses that you can do to upgrade your skill. And in the meanwhile, you can practice under some well-known doctor and get perfect clinical skills also. So that
And
is
also I
also
think
there.
after 2 to 3 years of practice, you have upgraded. You can even plan to put up your own clinic.
So
That is also one more thing. Or
Right.
you can do your MDS degree,
MDS
or
degree.
you go abroad. Abroad also there is a scope, but if you are starting as a fresher, I think you have better scope to go to abroad and do the further studies than stay back here for 10 years and then you plan for abroad. I think that takes a long time as
Yes,
such.
true.
In India, how much will it cost to establish a clinic?
So clinics may, you can start off with a basic clinic, or you can directly go into a premium clinic. As in, see, there are a lot of equipments and materials that will be required to start a clinic. So if you are opening up a high-tech clinic, then there is no end for the investment. And basic to basic, even the simplest machines, whichever is required, will cost you at least 5 to 6 lakhs. Would be your initial investment if you are starting off a basic clinic also. And plus then the running rent and what all, I mean, everything else is there, so it's not a easy task.
So on an average,
There is
around 6 to 8
6
lakhs.
to 8 lakhs is a minimum investment to start off. And plus you need clinical skills also, you need management skills, you'll have to manage the clinic yourself. So you need to know how to handle staff, you need to know how to handle patients, which is not taught in college, So these things have to be learnt before you start your own practice.
I think being a dentist, it's more of a entrepreneurial journey. So you have to learn a lot of things putting up a clinic, people management, as he said, and inventory management. Your communication skills have to be good, your way of talking to the people, and getting marketing and branding done for the clinics. There's so lot of things involved. So these things are not taught in the college. We are only learning dental skills. So I think somewhere we need to have this sort of small MBA sort of thing even in our internship, so that we understand what we are getting into. So
It's
that
true for all the courses, not only dentistry.
yeah, that is,
Yeah,
I think
colleges should come out with some additional
Yeah.
training
At least in this
In
part.
the curriculum itself, they should add these things.
Because if they know this part, then I think you will be in a better position to open up your clinic. Because we had a tough time. I think it took us first 10 years to learn the skills, and then another 10 years to learn to understand कि भाई ये ज़रूरत है. We need to understand marketing. We need to understand communication skills. I mean, we are not the salesperson. For us, talking to patients, it's more of a ethical way of talking, genuine care and all those things. When it comes to promoting yourself, we are not used to it. So somewhere we have to learn those communication skills also. That helps in our clinic journey.
So what is the scope of MBA? So in our physiotherapy, we know that masters is important and it is something that is eventually to be done, is better to be done. But in your course, is it mandatory? Is it required to become a good dentist, or is it just an add-on course?
Or you can, after just completing your bachelor's degree, you can do different courses and then only establish your clinic, and that will also work. Or doing masters is mandatory.
Doing masters is not mandatory, but yes, it's an advantage, because see, not many people know that dentistry in itself has so many branches. So you have, I think, 8 branches where you can do your masters. So there is surgery, then there is orthodontics, then there is pediatrics, root canal, endodontics, conservative. So many are there where you can do your masters and you can specialize in that particular skill, and you can limit your practice to that particular part. Suppose you're a surgeon, then you can do just surgeries, or you can join an institution or college and become a professor. So that part is also there. So it's not a mandatory thing, but yes, if you are, I mean, see, even in dentistry, as a dentist, I like some skill, some part of dentistry more than the other part. So you can go ahead and do your masters in that and excel in that department. So it is not mandatory, but yes, you can use it to your advantage.
It's an added degree.
Yeah,
actually.
it is an added degree.
And it also depends in certain places. Like I would say, I'm from Mangalore. So in Mangalore, I think people are more aware of dentistry because there are quite a few dental colleges. So they are looking out for a MDS person. Whereas in Bombay, it is not a thing. You have to have a MDS degree. You can be a good BDS dentist also without any specialization. If you're good in your skills, that is also good enough. Like we both are just general dentists. We have not done a specialization, but we are still managing. So that way,
as you said, they are added on certificate courses or small time courses, which is not a degree, but then you can get those skills done. So we have done implants, we've done cosmetic courses, and we are doing that in our private practice. So it helps you, of course, but then yes, having an MDS is also an add-on.
Yeah.
But is it worth it? Like, is it worth putting those extra years and putting that extra effort? Like, does it make a lot of difference when it comes to the pay that you get as a doctor?
If you get a degree, it's always going to be useful for you. I would not discourage anyone who wants to do MDS. But getting an MDS seat is not easy, so you need to really study well for that. And then getting into an MDS is not the end of it, it's just the beginning. So either you need to get through NEET, I mean it's really difficult, so you need to have a good score, or you need to have lots of money to get into a private college.
Even if you get through the NEET also, there is quite a lot of investment for 3 years.
Quite an expense for doing an
expense.
MDS is not at all cheap. It is costly even if you get a good rank. So yes, I mean.
But again, I think it comes finally to your passion about dentistry.
Yes.
If you are ready to wait and have the passion and upgrade your skills.
Worth it in terms of financially, see.
Like what will be a
MDS has to struggle that initial period of part. There is no there's no job opening which is easily available. None of the hospitals that you go and has a dental attachment, right? So there are no requirements. Some of the big hospitals, maybe say these big chains, have dental attachments, and there is a requirement for MDS doctors.
They do have, but again, there's a lot of competition.
They are picking up very senior and qualified dentists. So a fresh MDS is still going to struggle. Go and visit a lot of clinics where he can, he has to go visiting to a lot of clinics. Go ask for work there. So having an MDS is an add-on, yes, but it doesn't rule out the struggle part. You still have to struggle.
On an
Financially, maybe yes, the pay could be a little bit more than what a BDS gets.
Yeah.
how much more, if you can just give an idea around
I think
approx?
approximately 35 to 60 to 70,000 per month is what to start with, I
If you
suppose.
join
As a
MDS
MDS
doctor. But
staff.
most of the MDS doctors that we know, as in that's how their practice is. Either you start off your own clinic or you go visiting to different doctors. As in मेरे पास pediatrics नहीं है तो I call a pediatric dentist. And then there is a system that works in percentage basis. On
Okay.
patient we have this. So that is how it works, and that way they make quite a bit of money in that.
Yeah,
also.
if they're consulting various clinics,
Consulting.
then obviously they're
Yeah.
making money more than that.
More than that.
This is I'm talking about the
If
fixed
we
pay.
are fixing, I should say a fixed pay for an
Yeah.
MDS doctor. So that would be it. Yeah. But an MDS has an advantage of joining a college, an institution for teaching,
Right.
which is not
Yeah.
there for a BDS. A BDS can join as a lecturer, but that kick is not there. That MDS, I think MDS
Yes.
only has that.
And
advantage.
even government jobs, there are quite a few opportunities for the MDS guys. I think they will be looked upon first than the normal
Than the
BDS
BDS,
guys.
yes.
That is there. I think there is a dental segment in railways also, ESIC, hospitals, even army corps.
Army.
So all those they have an opportunity. But again, there's a lot of competition, and seniors will be considered. That is.
So to sum up that, it will be better for if you are looking for a teaching job or joining a government or looking for a better pay, but overall the struggle is kind of similar for both the
Yeah,
courses.
both the
Challenges did you face throughout this journey? And more importantly, I read one comment which made me very sad, that is this course safe for girls? Like one of the student who was giving needs as this course, and we are living in 2025, but still that some students have that fear in remote areas or somewhere, that is taking this course safe or not. So
I would go for this first because as a lady, I thought BDS is very good for ladies because you have a work-life balance there. You have a choice whether to work in the morning time or in the evening time. If you're putting up your own clinic, you have a set time. You can give your time to your family also, and you can give time to the clinic also. So you don't have to be there full time. You can always hire a dentist, a fresher dentist to look after the clinic in the morning time. Evening time, if you want to give 4 to 5 hours of yours, you have that opportunity. Whereas I don't see that happening in any other profession. I mean, it's a full-time job for everyone. That work-life balance is not there. Unless you really are passionate, you want to work full-time, that is also there. But I think for ladies, dentistry is the best. But again, there are two things here. If you are only looking at the money part, you might take it slow, but you have that balance. You have some money coming in also, you have your work profession also going on, and at the same time you are able to manage your family. For me, I think that dentistry is the best, I would say. Even for clinics, if somebody wants to set up and they have a choice to set up only few hours, like let's say from morning 10 o'clock to 6 o'clock, 7 o'clock, then after that they can close down.
Right.
So they don't have to keep it the whole day open until 9 o'clock, when it is scary. They can close it by 6, 7 o'clock at the max. That should be your time for the clinics.
The challenges that you have faced in building this clinic and coming so far, I'm sure that must have been your own set of challenges. So if you would highlight some that might coincide with other people who are looking up for this course.
the early challenges.
Early challenges is the investment part of it, because you're looking to recover that investment. So that waiting period, you have to wait, at least give it 6 months time. But it's the same thing with any other business, I would say. I mean, 6 months to 1 year is something which you have to give, and you have to have that sort of backup with you कि भाई हाँ 6 महीना सोच के चलो कि कुछ नहीं चलेगा तो I have some backup. Then after that you work on the, as I said, branding, the marketing part, and your skills, how good you are, how you will build up the trust factor with the patients by giving a genuine care. All those things matters, because I think connection with the patient is the first thing which we should really care about, because that is where the patients will connect to you, and that is how your build up of the patients happens. So that time and ethical way of doing things is a must, I would say, initially. Don't go just because you have invested so much, don't go just for the money. The money is not going to, even though it might show you ki you're earning a lot of money, it will not sustain for long. I would say that. The other challenge is, yes, to manage the team, to make them work as a team.
Find the right set of people also.
Yeah, in a clinic, because you have a receptionist, you have an assistant, and then there is a patient. So you have to manage everything. So that learning will be there. One is investment, one is team management, and building up the practice. And that is
Yes.
the challenges.
The
I
challenges,
guess.
yeah. Initially, see, first of all, as I said, when we come out of college, we have no knowledge about
Yeah.
these things. So first, you need to study about what equipments are required, which is the better one, and then there are so many choices. You have to know which one to pick up. And initially, we picked up quite a few wrong things also. That's how you learn.
That's you learn.
You buy something which is
Correct.
of no use, and something that didn't last that long, and something that was cheaper but didn't work out well. So these things are there. Initially, we had these problems when buying and keeping things. Managing these things is also difficult. The investment part, as she said, was there, and then you have to look at return of investment, whether the money is coming back or not. So that initial period of waiting period is there. I mean, it's not that very fast business model as such. So you have to wait, and team management is extremely difficult. You need to find the right people.
Right.
Finding good staff is also a very, very difficult task. So yes, we had a lot of challenges. We still have. Life is not that easy, but yes, it goes on.
Considering the other corporates like engineers and all, they have, it's like you have a backup there. You are joining an office. Everybody is there to guide you.
Correct.
Whereas here you are just
Yes.
left alone, and you
It's
need to
absolutely
understand what I am supposed to do. There will be seniors and all, but again, it depends. If you get a good senior mentor, they will guide you, or you have your parents who has set up a clinic, so that's the best thing for the guys to continue that thing. You can concentrate on your niche skills, which subject you want to go in for, that way. But as a fresher and no backup, it is like you are sitting. That's the learning part. I mean, that is all the life is all about. So
And if a patient is coming, for example, just a normal tooth pick, so what will be the charges for that particular patient? For physiotherapy, if someone is coming for a consultation, also it ranges around 600 to 1000 for one session also. For what is the charges for dentistry?
this, you're talking only about the consultation part of it?
Overall, the consultation and the treatment.
And the treatment. Okay. So in Knee Wellbeing's, the dental clinic, our consultation fee is 200, but we do only the consultation part of it. We see the patient and see what is required. If the X-ray and all is required, then we go further with the other treatment. And also, you want us to tell us about the treatment charges also?
Yes, overview.
So maybe let's say a normal filling will cost you around 1000 to 1500, and this is a tooth colored filling I'm talking about. Then a root canal will cost you around anywhere between 4000 to 6000, depending on whether a experienced general dentist is doing or a specialist. So that is there. And crowns, again, there are different varieties of crowns. We have metal crowns, your metal free crowns, the ceramic crowns, and so many other ones. So anything, I think the metal crowns will start somewhere from 3000 onwards, and for the higher value, the Emax aesthetic crowns and all, it will go up to 10 to 12,000. So there are clinics which will charge more, again because of the experience and because of the specialist involved. So that is how it is.
Yes.
If a clinic has a good patient flow, so what can be the monthly income of that clinic after 10 years or something?
Depends
For
on
10 years.
which place you are
Yes,
situated.
yes.
Like
Lot of
even
factors.
in Bombay, I think if you go towards South Bombay, the cost factor is really increased.
Yes, absolutely.
It's again because of the rental play of the shop, and all those things are involved in that. And if you go towards
You want a
suburbans,
figure?
then it is less.
If you want a figure, I would say 4 to 5 lakhs is something that you could expect
In a month.
in a month.
Yeah.
Revenue.
Starting from there.
Not,
Starting
I
from
mean, yeah,
there.
that's what. Not immediately after you start your one
Yeah.
clinic. After a while, maybe after 2-3 years, you should be doing 4 to 5 lakhs. per clinic revenue, but
Yeah.
as in profit would be much lesser, because see, you can hold it as almost 50% overheads.
Yeah.
So that much expenses is there.
Your rental, electricity, the staff,
and
all those things,
and
materials,
equipments, all that is there.
lab charges, all those
So,
things will be involved. I think
yeah.
50% of
50%
that.
overheads, and anybody who's been practicing for more than 5-6 years should be around, the figure should be around 4 to 5 lakhs.
Yeah.
Definitely.
Or more than that
More
also.
than that also is possible. Yes,
Depends.
absolutely depends on which area you're practicing, what are your treatment options that you're giving.
Built a lot of successful clinics around, so there is something that you've done right to get all those patients and get those successful clinics. So what do you think, according to you, is that one thing, or that something that you've done different to get that right?
Or the secret recipe.
For us, I think the after COVID is when we actually started more into social media, because that is the in thing and we need to be present on social media. I think the before COVID times, it's the word of mouth, it's the patient experience what we have given, it's the ethical treatment what we have given, whether it is really important at that particular time, and the affordability. I know people, that's again a challenge which we had not discussed.
Yes.
Is dentistry is something people avoid because of, one is the fear, and the other thing is the cost. So, and then we don't have dental insurances, so that is another challenge for us, and unless and until the patient is in real pain, that is where the patient comes into the dental clinic. Otherwise, not like the MBBS doctors wherein कुछ भी हो जाए डॉक्टर के पास, वो नहीं होता है यहाँ पे डेंटिस्ट्री में. That is something I would say. So I think word of mouth and proper genuine patient care is what I would look into.
Yes.
That is
I
the
think, yes.
that
Bottom
is
line
how
is
we have sustained.
You give good treatment, be empathetic to your patients, treat them well,
Yeah.
solve their problems, and the patients will come back to you. That is the motto. I mean, if you do that right,
Yeah.
your patients will come back with more patients to you. And don't look into this short-term money making, do this, do that, and then you don't do proper work, you'll get into trouble. So
I think that will sustain you
that
for
will
long.
sustain,
Right.
yeah.
That
Long
is
run.
long run. You need to really genuinely care for
Right.
the patient. That is where it is important.
Being true to the patient and also to yourself that you're not doing any,
Yeah.
because the patient doesn't know what we are doing, but
Yes.
we ourselves
Patient
know.
doesn't know. Actually, dental awareness भी नहीं है.
Right.
So now it has come up. Obviously, a lot of people come from the Google search, looking into the Google. So we have to explain that certain
Yes,
times.
yes, yes.
But yeah, I think dental awareness has increased than what it was prior when we started off. Now that is much more. People are more aware about it. But still, there's a long way to go. There's a long way to go.
And
Yeah.
one last question: what is something which people don't know about this field? Any dark reality or something which you are in this field, you know this, but from an outside perspective, they don't know about this?
For
Dentists make a lot of money. That is something which is probably there. Unfortunately, they don't know that some part of the treatment is really costly.
No,
There's a lot
here
of cost
I also
involved.
would want to add on to this. People think it is costly, but people are ready to spend on all these costly
yes,
bags,
absolutely.
your
iPhones,
iPhones, and
yeah.
all things, expensive ones, but they don't think dental health is important. That is where, even if it is costly, but I think you're spending on your oral health.
Correct.
And oral health nowadays, I mean, there's a lot of researches which is happening that it shows that oral health actually is helpful for your overall
Whole
health
system.
also.
Absolutely.
That is, there's a lot of connection towards the heart, your mental health, Alzheimer's and everything. So I think overall I think you should be thinking about dental health first rather than spending on all the other things. For me, that cost factor, I
Yes,
think I
that's
don't.
what I said. People, someone from outside dentistry might think that dentistry is costly. That is something, but actually
Yeah.
it is not. And compared to other countries, dentistry over here in India is
it's
probably
much
the
cheaper.
cheapest.
It's much
So
cheaper.
we have a lot of NRIs and outside patients also coming into
Coming
India
in.
and getting their treatment done at
Yeah.
quarter, probably less than quarter of cost of what it is outside. So dentistry in India is actually not very costly. It is affordable. It is approachable.
And I
Outside
think we have
you
good
will not
doctors
even
in
get
India.
an appointment from a doctor.
Yeah.
Here you can straight away walk into any clinic and speak to a doctor straight away
Yeah.
on the
Yeah.
first day. You don't actually need an appointment also. You can meet a doctor straight away. So that way I think
And also we have good dentists also in
absolutely,
India, so you
high
can
level,
Right.
high skilled. Our
you
colleges
have
are
a
really good.
I mean
Yes,
a whole
yes.
list of people wherever you want to go, you can get it done.
Yes,
Actually, that
absolutely.
is
Dark thing for students maybe if they feel dentistry is easier to study
As compared to-
as
then they are
compared to
wrong.
MBBS. Yes,
There is a lot to study.
there's a lot to
There
study.
is a lot to study. Maybe slightly lesser than MBBS, but then yes, BDS is difficult. It's not easy. So if you're putting up a clinic right now in this age with so much rent and
Yeah.
other costs, then you would expect patient to come to your clinic from day one, which is very difficult.
Yeah.
So
And I
It's
think
really tough.
because of that also there is a disadvantage. People go into unethical practice
Right.
just to make money,
Probably,
which I don't know. I mean, it is their thought process also. But yeah, stick to the ethical practice, and with some patients, I think you should be good enough with that.
If you have any more questions regarding BDS, you can connect with them on Instagram. Now, let's begin with physiotherapy. Okay, the first question, BDS or BPT, which is better for future scope? I think physiotherapy wins here if we compare both the market, the BDS market and the BPT market. The BPT market is growing at a better pace as compared to the BDS market. And one drawback kind of thing in BDS is that BDS field is slightly saturated. For example, you can go around the place you live and count the number of dental clinics nearby. So you will find a good number of dental clinics. But it is not the same for physiotherapy. This shows that there is still a better scope for physiotherapy as compared to BDS. And you can see the saturation in dental field is more as compared to physiotherapy. Average salary after BPT for freshers and experienced physio. I think the initial salary after graduation for both of them will be kind of the same. But one plus point for physios is that they can do home visits for which they can get extra pay. I'm not sure it is the home visit part is there for dentistry also because you will need to get tie up with a clinic or somewhere. But for physiotherapy, you can get tie up to a hospital, clinic. Plus, you can do home visits, which can give you more money. The salary will depend on whether you are joining a hospital or you are joining a clinic and also the duration you put in. To give you an average, if you are joining a clinic, you can earn somewhere between 8 to 15,000 per month. And this is, I'm talking initially, like you just completed your graduation and you go to join a clinic. This is the salary range which you can expect. And if you're joining a hospital, it will obviously depend on how well known the hospital is. It will range somewhere between 10 to 20,000 per month. Again, I'm talking about the initial salary which you can get after completing your degree. After some experience in clinics, you can get somewhere between 15 to 25,000 per month, and in hospitals, you can get somewhere between 20 to 30,000 per month. After completing your masters, you can expect your salary to be 10 to 15,000 more per month. And after a certain time and experience, you can start earning more than 50,000 per month. If you want to watch more about physiotherapy, we have covered it in our previous videos about the dark reality, about the life of a sports physio, neurophysio, how much will it cost to establish a clinic, the future scope, etc. etc. Okay, now according to me, which course should you choose? Which is better, physiotherapy or dentist? I will say don't choose both because you need a bigger perspective to think, not just the future scope, the salary point of view. Because right now, as I said, the dentist field is saturated, but this we are talking about 2025. If you join college now, you will graduate after 4 to 5 years, and till that time, the saturation in this field will also increase. So, in long run, the people who are really passionate about the field will survive. The people who really want the patients to get better. I have talked about this in one of our previous videos that the only reason why I chose physiotherapy was not because of the market or anything, because I just got a strong gut feeling ki, okay, this is my course, I will love doing this course, and it was a very strong gut feeling. I didn't have any idea about the market or anything, and it turned out to be right, because I felt like this is something which I will love doing, and irrespective of any field or future scope or anything, if you really are passionate about that field and you are willing to grow, willing to learn a lot of things, earn also you will eventually earn also good amount of money. But it is money is like a secondary thing which you will be getting for the primary thing, and the primary thing here is the passion, is the drive which you have inside you for the field. Because I do have an idea about all the fields, and I also have my friends in dentistry, in Ayurveda, and etc. etc. And after some amount of time, I've seen, people don't really pursue that particular thing only. They try to switch their career because they are not enjoying doing it. In MBA schools also, you can see a good amount of doctors going because they are not really passionate about the medical field. So in short term, you can think, okay, your relatives might say कि मेरे चाचा का लड़का ये डेंटिस्ट है या फिजियो है, ये इतना कमा रहा है, ये करियर बहुत अच्छा है, आपको यही लेना चाहिए. That might be true according to the market, the scope, and everything, but that might not really work for you. What if you are not passionate about this field? What if this is something you don't like to do? What if you need to ask all these questions to yourself and find an answer which is true, which is true to yourself, which is true to what you want, and not just for the society. You need a bigger perspective, a bit bigger understanding about everything, because in long run, people who are really passionate will survive, will earn good, will be happy also. But people who chose because of the market, because of any other reason, might not really survive in the long run. Because in short run, okay, it might feel good to earn a good amount of money, but later on you might get stuck in that bubble which you have created for yourself. So think, irrespective of what you choose. For example, you are choosing physiotherapy, so right from first year only you will need to evaluate yourself and see. For example, you might not really have good communication skills, you might be an introvert. So after completing your degree, you can be the best, physio, but if you're not able to communicate, the patient might not really be confident with you, so you will need a good amount of soft skill also. So from the first year only, you need to start developing yourself in terms of your body language, the way you talk, the way you present yourself, and many more. And more importantly, you also need to understand the market. For example, if any physio clinic is going good, you need to start evaluating, okay, what are the things which are working right for him. So should I immediately open a physio clinic after graduation or not, and etc. etc. This will give you a good perspective and good thinking, and also give you a direction which you need to follow, the skills which you need to acquire, all these things. So it is really hard to survive in this time, because of the world is moving very fastly. And if you're not upgrading yourself in all the terms, not just your profession, like you will also need an entrepreneurial mindset to think about the marketing, the how to handle people, and there are a lot of more stuff involved if you are opening a clinic. So, and you need to learn to manage your finance. Like, you can't spend a big amount of money initially only if you are starting a clinic. So there are many things which you need to learn about finance, about marketing, about your personal skills, also soft skills, hard skills, etc. etc. So think that way. That was the video. If you want us to more do a similar kind of thing with Ayurveda or any other field, then let us know in the comments, and just follow what your heart says.